Welcome. Our team here at Medicare Rights has made this video to help you understand Medicare enrollment. Let's get started. We'll be covering the three categories of enrollment periods for those who are not already enrolled: the initial enrollment period, the general enrollment period, and special enrollment periods. Then, we'll cover making changes to Medicare plans after enrollment. First, it is important to note, when talking about Medicare enrollment, that if you qualify for premium-free Part A, you can enroll in it at any time. You don't need to wait for an enrollment period or worry about a late enrollment penalty for delaying enrolling in premium-free Part A. Most people qualify for premium-free Part A. This qualification is based on years of work history in the United States, which pay into Social Security. 40 quarters of work, or 10 years, qualifies someone for premium-free Part A. This can be based on someone's own work history or the work history of their spouse. Enrolling in Part B or Premium Part A is more restrictive than enrolling in Premium-Free Part A. Our focus will largely be on Part B enrollment. There are two ways to enroll in Medicare: automatic enrollment and active enrollment. Let's start with automatic enrollment. Someone is automatically enrolled in Medicare if they either receive Social Security benefits or railroad retirement benefits for at least 4 months before turning 65. People are also automatically enrolled when they have been receiving Social Security disability insurance, aka SSDI, or railroad disability annuity checks. Usually these forms of disability checks initiate Medicare coverage on the 25th month of receiving them, with the exception of ALS, for which it kicks in the first month. In these automatic enrollment cases, people receive a package, typically a few months before Medicare coverage begins, which includes their red, white, and blue original Medicare card, notices, and an option to decline or not take part in Part B. It's really important to talk to someone knowledgeable and trustworthy about this decision, because declining may worsen care options later down the line. Many people, however, are not automatically enrolled in Medicare, but rather have to actively enroll. There are three main times to enroll in Medicare: the initial enrollment period, the general enrollment period, and special enrollment periods. Most people want to enroll in their initial enrollment period, when they first become eligible. The initial enrollment period is the 3 months before someone's 65th birthday month, the month of their 65th birthday, and the 3 months after. The coverage start date depends on when during this 7-month window someone enrolls. Most of the time coverage begins the first of the following month, although no earlier than the first of their birthday month. To illustrate, let's say someone is born on May 17th. They can enroll anytime starting in February, but coverage will not begin until May. If they enroll in May, their coverage will begin in June. If they enroll after May, it will begin the first of the following month. The last month they can enroll with the initial enrollment period is August, so the last day their coverage might start is September 1st. The next enrollment period we'll discuss is the general enrollment period, which is usually the last resort. The general enrollment period runs from January 1st to March 31st each year. People who enroll during the GEP often have to pay a late enrollment penalty. This means that the monthly premium will be more costly for every year enrollment was delayed. This late enrollment penalty is usually a lifetime penalty. Like the initial enrollment period, your coverage start date depends on when you sign up. It'll start the month after you enroll. So if you enroll in February during the GEP, coverage would begin March 1st. The third time someone can enroll in Medicare is during a special enrollment period, or SEP for short. These are periods of time outside normal enrollment periods, typically triggered by specific life circumstances, and not a time of year. Because someone can enroll in Premium-Free Part A at any time, SEPs only apply to Part B and Premium Part A. The most common SEP is used when someone has coverage from a current employer. Because people can delay Medicare enrollment if covered by their own or their spouse's current employer, they may qualify for an SEP while they work for that employer and for a few months after. It's critical to note that current employer coverage doesn't include retiree or COBRA insurance. In most of these current employer coverage cases, people who are already paying a premium to their current employer insurance don't want to pay another premium to get Part B coverage. However, if the job-based insurance is secondary to Medicare, it's better to enroll in Part B to avoid costly care. It might also be worth paying 2 premiums if you have expensive treatment, and the combined coverage brings down the out-of-pocket cost of care. To clarify, When someone has more than one kind of insurance, insurances pay for things in a certain order. Primary insurance pays claims first, and then secondary insurance picks up costs after primary insurance is paid. Job-based insurance is primary when an employer has 20 or more employees and the person is eligible for Medicare due to age. If someone is eligible for Medicare due to disability, job-based insurance is primary when the employer has 100 or more employees. You might consider delaying enrollment in Medicare when your employer insurance is primary. But if it's secondary, you should enroll in Medicare as soon as you're eligible. Employer insurance will become secondary, even with no primary insurance coverage. This can lead to costly coverage issues. If employer-based insurance is primary, the employer will give proof that you have primary insurance from them, and the SEP will be available while you're working for them and up to 8 months after. There have been additional SEP qualifying events added in 2023. These include loss of Medicaid coverage, being in an area with a disaster or emergency, release from incarceration, or if an employer misinformed an employee of their enrollment obligations. Most of these SEPs do not apply to events that took place before January 1st of 2023. Other exceptional circumstances means that Social Security will consider some circumstances on a case-by-case basis. To use an SEP, someone has to contact Social Security and provide proof of a qualifying event. For example, this could be a piece of mail showing your home was in an emergency area, or an email from an employer acknowledging they provided misinformation. On to our final section, making changes once already enrolled in Medicare. There are two pathways for receiving Medicare benefits: Original Medicare with or without Part D prescription drug coverage, or through Medicare Advantage, which typically includes Part D prescription drug coverage. Once enrolled, some people want to switch between Original Medicare and Medicare Advantage, or if they have Original Medicare, they may want to switch just their Part D plan. There are three main times one can change their coverage: the Fall Open Enrollment Period, Medicare Advantage Open Enrollment, and Special Enrollment Periods. Fall Open Enrollment happens every year from October 15th through December 7th. You can make as many changes as you want in that time, and the final change becomes effective on January 1st. There's often an uptick in advertising materials around this time, which may help with considering what options are available, but can also be overwhelming or confusing, so it's important to be cautious. The next enrollment period is Medicare Advantage Open Enrollment, which is from January 1st to March 31st of each year. This enrollment period is only available to people with Medicare Advantage who want to switch Medicare Advantage plans or go back to Original Medicare. This enrollment period is not for people with Original Medicare or those interested in changing Part D plans. You can only make one change during this time, and it becomes effective the first of the following month. Lastly, special enrollment periods. Like Medicare enrollment in general, changing plans with a special enrollment period is triggered by specific circumstances, like moving outside of a plan's coverage area, the loss of creditable drug coverage from an employer or other organization, or qualifying for certain cost-saving programs like Medicaid, Medicare Savings Programs, Extra Help, or a state pharmaceutical assistance program. There are also SEPs in response to contract violations or enrollment errors, such as being enrolled in a plan unknowingly, or being in a consistently low-performing plan, as it's rated on Medicare's star rating system. To recap, people who qualify for premium-free Part A can enroll at any time with no late enrollment penalty. With respect to Part B, some people are automatically enrolled and some people must actively enroll. There are three types of enrollment periods for active enrollment: the initial enrollment period, which is based on the individual's 65th birthday; the general enrollment period, which takes place every year between January 1st and March 31st, and special enrollment periods, which are not determined by time of year, but by the timing of special circumstances and qualifying life events. There are also opportunities to change plans during the Fall Open Enrollment Period, which is October 15th through December 7th, Medicare Advantage Open Enrollment from January 1st to March 31st of each year, and special enrollment periods specific to changing plans. We encourage viewers to visit MedicareInteractive.org for more information, or call our helpline at 800-333-4114 for enrollment questions and assistance. Thank you for watching.